Second-line treatment for GSM includes hormonal therapy. Most commonly, this is a local estrogen, meaning estrogen that is placed in the vagina in the form of a ring, a tablet, or a cream. This is very different from systemic or whole body estrogen that is given by oral tablet or through the skin in the form of a gel or a patch. So let's go through them. The ring, which is a form of estrogen called 17-beta estradiol, also known by the trade name as estrogen. It has the least amount of estrogen and it's placed in the vagina for 3 months. It then needs to be changed for a new ring. This is typically done by the patient, but it can also be carried out in the office setting by a physician. The tablet, also estradiol, is known by the trade name Vagifem. It is a 10 microgram tablet that sits at the end of an applicator. The tablet and the applicator are pre-packaged together. The tablet is placed in the vagina with the help of the applicator. Typical starting dose for this medication is every night for 2 weeks. This is called a priming period, and then twice a week thereafter. Vaginal creams are considered the strongest types of local estrogens, but patients sometimes find them a little bit messy. Creams offered in Canada include conjugated estrogen cream, also known as Premarin, which comes in a tube. Doses will vary between patients, but typically patients use 1/4 applicator twice per week. Your doctor may recommend a priming period before this. The cream can be squeezed into the applicator tube and inserted into the vagina with the plunger used to dispense the medication. Some people report Premarin cream smelling a bit like lilacs. Estrogen cream is simply a different form of estrogen called estrone. It is typically placed with the help of an applicator that is similar to the one just described for Premarin. Common dosing is 1/4 applicator used twice per week, but your doctor may suggest something different. With typical dosing of these local estrogen products, most gynecologists do not recommend a progesterone to protect the uterine lining because the amount of estrogen absorbed into the blood is not typically high enough to stimulate the lining of the uterus. This is different from whole body or systemic estrogen use that does typically require a progesterone if people still have a uterus. Local estrogen should not be used by people who are pregnant, those with unexplained vaginal bleeding and active breast cancer. It is also not typically used by those who have an active blood clot or people with untreated endometrial pre-cancer or cancer cells. It can be used by most other people. Local estrogen should not be used as a first-line therapy for people with certain conditions, such as a history of breast cancer. Ensure your doctor is aware of your past medical history before starting any of these prescribed medications. Another hormone therapy for GSM recently approved in Canada is ospemifene, which is marketed under the trade name Ospina. It is an oral medication taken once per day. It is a selective estrogen receptor modulator, or SERM for short. It is a class of medication that acts like estrogen in some parts of the body, but it's an anti-estrogen in other parts. In the case of ospemifene, estrogen receptors in the vaginal tissues and bones are stimulated, but not those in the breast or the uterus. You do not need to take a progesterone if you're on Ospina. This medication is good for people who find vaginal estrogens to be messy or itchy, or anybody who has difficulty inserting anything into the vagina, such as those with medical conditions such as arthritis or obesity. It may also be a favorable choice for people with low bone density. While low, this medication carries an increased risk of blood clot. Side effects, while uncommon, can include hot flashes and night sweats. If you experience any vaginal bleeding while taking any medication, you should speak to your doctor. Another newly approved option is vaginal DHEA, but it is not yet available in Canada. Vaginal DHEA works through conversion into estrogen and androgen, of which testosterone belongs. Once placed in the vagina, it then works on estrogen and androgen receptors in the vagina. It's going to be marketed in Canada under the trade name Intrarosa. Vaginal DHEA will come in the form of a tablet that is inserted by applicator into the vagina once daily. It is being marketed to help with symptoms including painful intercourse, vaginal dryness, and other signs of GSM that your doctor may see on physical examination. Urinary symptoms such as urgency can be managed using medications to relax the bladder, as well as local estrogens that were already reviewed here. Speak to your doctor if this is a concern for you. Finally, many patients have recurrent urinary tract infections as part of their GSM. Your doctor may suggest a local estrogen, such as the ones we reviewed in this video, as well as an antibiotic to prevent bladder infections before they start. This is called prophylactic treatment. Finally, you may have heard about vaginal laser therapy to treat GSM. This is a third-line management option in Canada based on our guidelines. This is carbon dioxide or erbium laser therapy applied to vaginal tissues using a probe, typically in the clinic setting, to encourage tissue remodeling through formation of collagen and new blood vessels to restore vaginal bacteria present in premenopausal years and the vaginal pH. Data, however, comes from smaller studies, and more work does need to be done before we routinely recommend this treatment. In summary, this video has reviewed genitourinary syndrome of menopause today and its management strategies. Some of these management strategies may work for you. It's important to get more information from your doctor and speak to your doctor directly about your symptoms and what treatments might work for you.